When you come to the focal or localized hyperhidrosis, that's usually more of a genetic component. It starts early in adolescent periods. It's mostly something that you see in families. So you have that genetic component to it. So when you have that kind of a diagnosis, sometimes it's not necessary to do tests in all patients, because as soon as you get a history, listening to the patient, listening to where they sweat, the hands, the legs, the axillas, is it the entire body? Things like that would actually help you make a diagnosis based on what they're presenting with. Now, in case if it's the other category, which is the generalized hyperhidrosis, now that is always secondary to some problem. And usually the commonest is obesity, diabetes, thyroid problems, all right? Tuberculosis, for example, is one that is currently now on the decline, but infectious causes of particular, like excessive sweating, like what we call night sweats. So there are different causes of generalized hyperhidrosis. Now, as soon as you ask a patient, is this something that's happening with you? Is it something that you're experiencing? Is it something like, say, for example, are you taking alcohol? Are you taking different smoking habits? Things which patients will automatically tell you as a history will lead you to what exactly you can test on. So for example, let's say you see a patient, you see his BMI is way higher than normal, it's maybe around 40, 50. Patient is also having trouble breathing. You're seeing that there might be a bit of obesity and, for example, let's say diabetes, for example, now coming in. Then you take those particular measures and test for that particular thing. So when you test for, like, let's say diabetes, for example, you do a fasting blood sugar, you do a HbA1c, and you automatically will know that is this something that is related with that particular diagnosis or is it not? So those tests will tell you that this is now a diagnosis of, for example, diabetes. Then now you know that diabetes is that the patient has it. You take steps in that way and you reduce the problem which the patient is presented with, and you see if that is helping the sweating. If that was automatically helping the sweating, then you know that the condition which he secondarily has, for example diabetes, is the one leading to the hyperhidrosis, not that the hyperhidrosis was genetic like the other counterparts.